Welcome to Grand Rounds. Okay, the notice we're being recorded. Before I introduce our speaker for this morning, I'd like to begin with our land acknowledgement. Ottawa is built on unceded Algonquin Anishinaabe territory. The peoples of the Algonquin Anishinaabe Nation have lived on this territory for millennia, and we honor them and this land. Their culture and presence have nurtured and continue to nurture this land. CHEO also honors all First Nations, Inuit, and Métis people and their valuable past, present, and future contributions to this land. Now I'd like to introduce our speaker for this morning, Dr. Jean-Philippe Chaput, who is an associate professor in the Department of Pediatrics in the University of Ottawa, as well as a senior scientist at the CHEO Research Institute. And most recently, he is now the program director of probably the most fun-sounding and pediatric-oriented new teams at the CHEORI, the Ready, Set, Go team, which is a diverse team of researchers looking to improve mobility and keep our kids active and healthy. Dr. Chaput's research focuses on obesity prevention and the adoption of a healthy lifestyle. He's particularly interested in healthy behaviors such as sleep, physical activity, and nutrition. He has published more than 350 peer-reviewed scientific articles and is highly cited. He serves on many journal editorial boards and advisory committees and has contributed to a large number of conferences around the world. Dr. Chaput has received several awards for his research, including the Canadian Society for Exercise Physiology Young Investigator Award in 2016, the Roger Broughton Young Investigator Award from the Canadian Sleep Society in 2015, the International Journal of Obesity New Faculty Award from World Obesity in 2014, and the New Investigator Award from the Canadian Obesity Network in 2011. He also received the New Investigator Award from the International Association for the Study of Obesity in 2010. And most recently this year, he was recognized with the Faculty of Medicine Award for Publication of the Year in Public Health and Epidemiology. I am particularly interested in hearing what JP is going to be discussing with us this morning, as sleep is such an important part of our lives and our health. So without further ado, I'll hand it over to JP. The title of his presentation is Sleep is Not a Waste of Time. And I think you will know from his introduction that he knows what he's talking about. Over to you, Dr. Chaput.
Thank you very much, Dr. Jabour, and good morning, everyone. I can't see you right now, but I'm sure you're around having a coffee or getting ready to work. I'm in my basement in Chelsea, very close to the Nordic spa. We moved here a couple of months ago. So working from home, it's more fun to be in nature than to be downtown. So yeah, it's my pleasure to be with you today to talk about sleep a bit. So maybe to provide some tips that you may like to hear, some for you, for your patients. So hopefully it will be an entertaining talk, maybe a bit lighter than what you're used to hear. I don't know. So we'll see how it goes. So as Dr. Jabour was saying, the intent of my talk is to highlight the importance of a good night's sleep for all, for overall health and wellness, and provide some recommendations as well. First off, I would like to say that I have no conflicts of interest to disclose with you. And I will be very brief on this slide. You can see here me in Banff with Professor Mark Tremblay. So I'm part of the Healthy Active Living and Obesity Research Group, the HELO group at CHEO. Associate Professor of Pediatrics at University of Ottawa. I just applied for promotion to full professor this year, and also senior scientist at the CHEO Research Institute. Okay, now talking more about sleep. So what's the landscape in Canada? So about 1/3, so 25 to 30% roughly of kids, school-age children and adolescents sleep less than recommended for their health. The recommendations for school-age children are 9 to 11 hours of sleep, and for adolescents is 8 to 10. So those sleeping less than the recommendations, about 1/3 of Canadian kids sleeping less than that. The long sleepers, so those sleeping more than this range for sleep duration, about 1% of Canadian kids. So the long sleepers don't really exist in Canada. The problem is really with lack of sleep or short sleep duration. We see also some catch-up sleep over the weekend, even in the pediatric population, 1 hour more on Saturdays and Sundays for kids. No differences between boys and girls, so it seems to be a problem across the board. If we dig a bit deeper, of course, we see higher prevalence of short sleepers in those coming from lower socioeconomic backgrounds and stuff like that, but no differences between boys and girls. So roughly 1/3 of Canadians, and same thing for adults, 1/3 of adults sleep less than recommended. So for adults, it's at least 9 hours per night. Sleep disorders are also common in the pediatric population. The key ones, insomnia, so trouble going to sleep and staying asleep. Prevalence of around 6 to 9%, depending on the studies you're looking at, the definition that you're using. Cognitive behavioral therapy is the first line treatment for that. Sleep apnea, between 1 to 6%. Excess weight is one of the risk factors with large necks. Dr. Sherry Katz at CHEO works a lot in this area. There's a sleep lab at CHEO if you don't know. Restless leg syndrome, about 2%, and narcolepsy, less than 1%. So sleep disorders is not only for adults, so we see that in the pediatric population. So sleep disorders is one thing, but also we see a lot of lack of sleep or poor sleep quality that is not related to sleep disorder. I think most of it is related to other factors: late night television watching, screens in your bedroom, lack of parental control. Many of those factors are not related to sleep disorders, but we may decide to sleep less for different reasons. Either we work too much, we have kids, we have many things in our lives. So many people decide to just sleep less, to cut on their sleeping time for other things in their life. We all have 24 hours in one day. So I think, but what I want to highlight today, this is something that we should prioritize more in our lives and see sleep as important as eating well and moving more in the package for good health. And that's what studies tend to show. And sometimes people think that, okay, as long as I move, as long as I eat well, the rest matters less. So it doesn't matter if I sleep 4 or 5 hours per night, if I check my box for physical activity guidelines and I meet the Canada's food guide, so sleep doesn't matter. Yes, sleep matters. I think overall health is a package of things, of good behaviors. And I think the more we have in that bucket and the more we can sustain over time, the best it's going to be. The sleep duration recommendations in Canada, they're very similar to those in the US. You can find that on the CSEP guidelines.ca website. The HELO group was highly involved in the 24-hour movement guidelines. I will present them. So sleep is part of the 24-hour guidelines in Canada. And you can see they are broken down by age group. Of course, the younger kids need more sleep because they are growing. So you can see the newborns, 14 to 17, infant, toddlers, going down to school age children, I said 9 to 11, and teenagers 8 to 10, and for adults, 7 to 9 hours of sleep per night. So this is from a public health standpoint. So this is the optimal sleep duration recommendations for better physical health, mental health, quality of life, things like that at the population level. And of course, as clinicians dealing with patients, you need to adapt those guidelines on a case-by-case basis, because in science, we look at the mean values, but the outliers or the extremes matter when we deal in clinical work. So it's possible that your patient needs way more sleep than what you see here. And we see that, for example, athletes, the Roger Federer of the world, they sleep 12 hours per day. So way more than 9 hours, which is the upper limit for sleep duration. So people may need more sleep than the recommendation based on what they're doing. So if I run a marathon today, I probably need more sleep than last night, for example. We see that with kids. So I will say that there's no magic number that applies to all. Most people should fit within those guidelines. We need to see that the chronic effect of lack of sleep over time are bad. So if 1 day per week you don't meet the recommendation, it's not going to kill you. But if it's 5 days of the week that you never sleep enough, and then you just catch up on the weekend and you maintain that for years, that's a problem. So I think we need to look at that, and I will talk about other aspects of sleep, because when we refer to sleep health, this is a term that we use in science and more as well. So sleep health is way beyond the quantity of your sleep or the duration, but we need to think about the quality of your sleep. So you may spend 10 hours in bed, but just getting 4 hours of good sleep. So sleep quality matters, the timing of your sleep. So when you go to bed, when you wake up. So for the same amount, you could be a morning lark or a night owl, for example. So the chronotype, the consistency of your sleep, catch-up sleep may matter, sleep hygiene. So a lot of things matter when we talk about sleep. But these are the guidelines to keep in mind, that most people should fit within those guidelines. Even though there's no magic numbers, our genes, our genetic makeup explains a lot our sleep needs. And that's why we see large differences between people. So if I ask you, what is your optimal sleep? So those numbers can be all different between us, even though it would be roughly between 7 to 9, but for some it could be 6, and for some it could be 11 per night, for example. I was talking about the Canadian 24-hour movement guidelines. So the first age group that was released was in 2016 for children and youth, so 5 to 17. And you can see the purple in the middle, which is the sleep recommendations. So these guidelines were in partnership with many organizations. The Public Health Agency of Canada were the main funders of those guidelines. They are owned by CCF, the Canadian Society for Exercise Physiology. And CHEO, can see in at the bottom right, the Hello group, we were the science behind those guidelines. So what you see this slide, it took 2 years and 1.5 million to come up with this. So a lot of money, a lot of time. There's a lot of work behind the scene that I will not present today. So we had to conduct many systematic reviews. We needed input from many experts around the world, stakeholder feedback and stuff like that. So we had to follow robust clinical practice guidelines with Agree-2, with GRADE to grade the evidence and come up with a consensus. You have to translate that. There's the marketing of it with participation, for example. Can be on social media, the news, and so on. So there's a lot of steps when we come up with guidelines. But the sleep portion of those guidelines is what I was telling you. So 9 to 11 hours of sleep per night for 5 to 17 years of age, and 8 to 10 hours per night for those 14 to 17, with consistent bed and wake up time. So it's not just the duration, but the consistency in your sleep, or having a sleep routine, is very important. And we talk about other things in those guidelines that you don't see on that slide. And I will explain why the sleep guidelines are part of the physical activity guidelines in Canada. I think it makes a lot of sense, but I will explain a bit later. So 2016, we released the 24 guidelines for 5 to 17. The year after, in 2017, was for the 0 to 4. And last year we released for the adults and older adults. So we have now the full suite of guidelines in Canada, but it took some time. So it was only in 2016 that we had our first evidence-based sleep recommendations in Canada. So I will skip that, but you can find that online easily everywhere. And we had also impact around the world. So the WHO, they mainly copy and pasted our guidelines in 2019. So for the under 5, so they released also 24-hour guidelines for the under 5. So they adopted our guidelines and they just changed a few words to fit, because it's a global scale. So the Canadian context is one thing, but those guidelines need to apply to Africa and all parts of the world as well. So of course they can modify the wording to make sure it applies to all, but mainly it's exactly the same guidelines that we had in Canada. So I think we had a good impact around the world, because they realized that we followed a very robust approach to develop those guidelines. There was no need for them to repeat the same thing, though they only had to update our evidence base. And then mainly it didn't change the recommendations, because it takes many years to come up with good studies to be able to change a threshold or a line in the sand when we come up with guidelines. So not one or two new studies will change guidelines. When we look at the whole population, so not the optimal sleep duration that is associated with health outcomes. So for guidelines, we use dose response curve associated with mental health, physical health, so to come up with those numbers. So mainly with dose response meta analysis. But here what we find in the population, so you can see that it goes down with age, so it fits with what we know. That's why the guidelines, you see greater sleep duration at younger age groups, and then it goes down. It makes sense. And then we have a paper accepted in the American Journal of Epidemiology looking at, these are the first sleep norms in the US, across the whole US, with objective measures of sleep to look at, if you look at the 50th percentile of sleep duration, so you see that it from 6 to adult, it goes down. It makes sense, but throughout adulthood, it's very, very stable. Only when you retire, you see an uptick in sleep duration, mainly explained by the fact that older adults have more time to nap. So we see more napping when you retire compared to adult age, but you can see very, very stable between 18 and 65. So why do we sleep less today compared to years or decades ago? So we've seen a decline in sleep duration. So the steepest decline has been seen in teenagers. If we look at all age groups together, adults, older adults, young kids, so mainly teenagers, for different reasons. I think screen time is a key driver of this decline in sleep duration over time. So teenagers go to bed with their phone. It disrupts their sleep. When you don't sleep, you want to be on social media too. I think we have more artificial light everywhere. So that's one thing we use to keep animals awake, but it works with humans as well. So if we live in a 24/7 society, so it becomes easier to sleep less. Can be late night television watching, drinking too much coffee and stuff like that, working too much. So there's many reasons, and people tend to cut on their sleeping time for pleasure and well-being, because I think a key one to me is we don't value enough the benefits of a good night's sleep for health. I think if we look at other countries, like in Asia, we see in many countries like Japan, we see sleeping pods in the workplace, so they value power naps, napping, sleep for health. But I think in America, I think we see napping or sleeping a lot as lazy people. We're not productive because we're sleeping. So, and we hear people like Donald Trump saying that, yeah, you should sleep 4 hours per night because otherwise you're just lazy. There's no point to sleep too much. So we're more in a work obsessed society here. So I think it should change over time. And I think the public health aspects of sleep is pretty new, what we see in science. So the field of sleep comes from the medical field, and it was very geared towards the treatment of sleep disorders. But the prevention in the first place, or having a good night's sleep for all, not just for those with sleep problems, but everyone should sleep well. I think it's pretty new, and I think we need more science, more studies in this field rather than just on sleep disorders or treatment. So prevention is very important. I think, and to value more sleep in our society will be important in the futures. And seeing studies when they compare, okay, what are the odds ratio or the risk of adverse health problems with lack of sleep versus a poor diet versus lack of exercise and stuff like that, realize that lack of sleep is a very important risk factors, and then we don't talk enough. I think in the future, because we have screens everywhere, even during COVID, we realized that we need our screens a lot. I think, I don't know about you, but I have Zoom meetings, a couple of Zoom meetings every day. So we need them. We'll never go back to where we were many years ago. So I think there's a lot of benefits with screens, but also there's some downsides that we need to recognize. So I think there are studies showing that the blue light of screens impact our sleep hormone that can delay sleep onset, and screen exposure before bedtime decreases sleep quality. So the recommendation normally in the 1 hour window before bedtime to not use our screens. I think it's something very difficult for people. So we had a survey in 2010 in Canada, and almost 100% of Canadians use their screens in the 1 hour before bedtime. Could be watching TV, laptop, cell phone. So I think we're pretty addicted to our screens, but it has an impact on our sleep patterns. I think we need to recognize that to find solutions. And not all solutions seems to work. So for example, there are some apps we could use to block the blue light from our screen. So let's say the night shift mode in iPhone. So you can set that, let's say at 8 p.m. and then the blue light becomes more orange. So it doesn't send the same signals to the brain. But the studies are not that clear about that, if it makes such a big difference. So I think overall, the key is to have a good balance on our screen. So not too much, and maybe not too much before bedtime if we can, but easy to say, but not easy to do. What about COVID-19 and the sleep of children? So with the start of the pandemic about a year and a half ago, many behaviors changed. So you've seen studies saying that we use our screens more, physical activity levels have declined around the world, we drink more beer and wine, and stress levels. But what about sleep? I think maybe sleep, good things and bad things depending on who you're talking to. So we've seen both positive and negative changes to sleep. We've seen an increase in sleep duration for a segment of the population. So people like me, I would say, working from home, so more flexible working hours. People maybe sleep in more in the morning, and they can decide to work more when they want. So I think this flexibility has helped a segment of the population with their sleep. So people sleep more now than a year and a half ago. We've seen that sleep timing shifted later. So for teenagers, for example, they were going to bed later, but they had to wake up later. I think we see a delay in their sleep-wake cycle for teenagers. It's normal for teenagers to go to bed about an hour and a half later compared to adults, but to wake up later. But if we want them to wake up early to go to school, it doesn't fit well with their biology. So that's why there were many studies showing that if we delay school start times for teenagers to after 8:30 a.m., so we see that teenagers sleep more and they have better grades. So in Canada, we're not that bad. I think the average is around 8:30 or 8:45 a.m. the school start times. But in the US, many high schools start at 7:30. So when they have to wake up and eat and take the bus, so most teenagers in the US sleep less than 8 hours per night. So they're sleep deprived, and that can impact their grades as well. If we compare adolescents to children, we've seen greater negative impacts on the sleep of teenagers than children with the COVID-19 pandemic. And there's a link with screen time here. And I'll just check my time. Okay, I think I'm good. And insufficient sleep, so both in terms of duration and quality, is associated with a long list of adverse health outcomes. So we see more weight gain associated with lack of sleep, type 2 diabetes, cardiovascular disease, mortality. So people die younger when they don't sleep enough. So chronic lack of sleep. Unhealthy behaviors, we tend to be more inactive because we're more tired, less likely to move. We sit more, so more screen time associated with lack of sleep. Unhealthy eating behaviors. So the brain, so if you restrict people, you put them in an fMRI machine, you can see that a lot of lights, it's like a Christmas tree. We crave for energy-dense foods, high in fat, high in sugar. So we crave for pizza, poutine, but not for fruits and veggies. Alcohol intake associated with lack of sleep. We want more beer, more wine, more liquor when we don't sleep enough. So we see that as a reward for the brain. More anxiety and depression symptoms with lack of sleep, irritability, suicides, risky behaviors. So we can think about drowsy driving, more likely to be injured in the workplace, weaker immune system, more likely to catch a cold or a flu with lack of sleep, lower grades, lower quality of life, well-being, and so on and so forth. So I think there are clear benefits of a good night's sleep. And keep in mind that it's more the chronic effects of sleep that matters more than the acute effect on one day. So if you don't sleep enough on one day, we'll see a lot of changes in your hormones. Leptin, ghrelin, cortisol, which is a stress hormone, will be higher. But the day after, if you sleep more, you recover from your sleep, those hormones come back to normal. So that's with one day. But the chronic effect over time, over months, over years, that's where we see health problems. I've done a lot of work during my PhD and even postdoc in Copenhagen and Denmark, trying to explain why short sleepers were gaining more weight And the key mechanisms is through an increase in food intake. So short sleepers, so let's say for adults like you sleeping less than 7 hours per night, eat about 350 calories more per day. So 350 more calories. So we just eat more. So of course, we gain more weight over time. So it creates a positive caloric balance and weight gain over time for two key reasons. So we see that lack of sleep is a stress for our hormones and metabolism. So increase in cortisol, increase in ghrelin levels, decrease in leptin levels. So we crave more for energy-dense foods, but also by staying awake longer, we have more time and more opportunities for eating. So if you sleep 4 hours per night, you're awake for 20 hours. You're more likely to go to the fridge and snack, and we use our brain a lot to work. So we need glucose for the brain. So those snacks are very handy. So there's a direct correlation between hours awake and calories consumed. So both an increase in hunger, but also just by eating in the absence of hunger as well, by being more awake. And on the other side of the energy balance equation, energy output. So for some people, it's not for everyone, we see a decrease in physical activity levels because we feel more tired, but increase in screen time and we just sit more. So that can decrease energy expenditure. But the key driver, the key mechanism is really with an increase in food intake that leads to obesity and other health problems. So obesity is a risk factor for type 2 diabetes, cardiovascular disease, mortality. So that's a key risk factor here. And in sleep studies, you tend to see with different health outcomes, a U-shaped association between sleep and those outcomes, mainly in adults. But the two peaks, long sleep and short sleep, don't mean the same thing. So first, there's way more short sleepers and long sleepers. And long sleep, because we tend to use self-reported sleep in most studies, I think we see more and more objective measures in studies. With self-reported, we misclassify sleepers because you may report you sleep 10 hours per night, but you're just getting 5 or 6 hours of good sleep. So there's misclassification. And I think in studies, when they use objective measures, we don't really see this U-shaped association. And when we control for other confounding factors, it tends to disappear as well. So with chronic pain, so long sleep is associated with chronic pain, depression symptoms. So I think for clinicians, long sleep is a red flag. We should see that someone sleeping way too much. But it's most of the time, a risk factor for other underlying health problems. So long sleep per se doesn't cause ill health, but it can be a marker for something else going wrong. So I think it should signal you that to look deeper, but the real problem is really with lack of sleep and health problems and not with long sleep. And in fact, the guidelines in the US for adults is 7 or more. They don't even have any upper limit. So 7 or more sleep for adults. So 24 hours of sleep will fit in the guidelines in the US, if you will. But at some point, I think if you just sleep, you have other health problems. And I think less time for other good things in your life. We need to eat, we need to move and stuff like that. So I think it makes sense there's an upper limit. That's why we have that in Canada. So when we talk about health and wellness, sometimes we use the two main pillars that can explain is good diet and then exercise. But sleep has been kind of a black sheep in the past years, and we don't value sleep enough. And insufficient sleep is not even recognized by the Global Burden of Disease Study, which is a big study by WHO when they put together all the risk factors for health. So smoking, obesity, poor diet, lack of exercise, but sleep isn't part of that. So I think that's why I was saying that we need more studies looking at the burden of lack of sleep for health, I think, and to also quantify how much does it cost the healthcare system to not sleep enough and stuff like that, to maybe to add numbers to that. And maybe at some point it will be valued more, lack of sleep for health problems around the world. So we're not there yet compared to other fields like physical inactivity or poor diet. And we just quantified, so I wrote this paper this year and just submitted to CMAJ, the economic burden of insufficient sleep duration in Canada. So I just look at insufficient sleep duration linking to different adverse health outcomes. And per year in Canada, it's about $500 million that we lose by insufficient sleep duration. So sleeping less than 7 hours per night for adults, for example, or less than the recommendations for teenagers. about the same burden in men and women, a bit more in men because the prevalence is higher than women. But yeah, $500 million, it's quite a bit of money that we could save. And it's probably an underrepresentation of the true cost of the healthcare system. And we look at direct costs and indirect costs as well in this study. We tend to see sleep as a waste of time, and good diet with exercise can offset sleep deprivation. So I think all behaviors matter for overall health, and beware of behavioral compensation. So I think we need to look at the big picture. Sleep should be part of it. And I think lack of sleep can be a driver of other health problems. So in the field of obesity, for example, some people eat too much, not move enough, but lack of sleep is a cause of that, and excess food intake and lack of physical activity are more symptoms of lack of sleep. So I think we need to dig deeper to ask questions about sleep, because it impacts many of our behaviors as well that we don't realize. So I think it's important to think about that. The history of sleep medicine, I think the focus has been on the identification and treatment of sleep disorders. I think that's what medicine tends to do in general. So no big surprise that. And the medicalization of sleep is not surprising and followed other disciplines with a focus on diseases, disorders, and their treatment. But there's now a movement or a momentum on health promotion for all and the prevention of health problems by keeping healthy people healthy. So I think the best treatment is the prevention in the first place. And I think sleep health is good for everyone, those with sleep disorders and those without. And that's why we use the concept of sleep health now, which is more this holistic vision of health. And the good thing with that, it's a common vision of improving sleep and health outcomes that integrates prevention and treatment on that continuum. So we look at everyone in the population. It started in 2014, so quite a few years ago. Daniel Lewis in Pittsburgh in the US, he came up with what he called the SATD, S-A-T-D. So in red here, you don't see that. So SATD, S for satisfaction of your sleep. So are you happy with your sleep? Daytime alertness, the timing of your sleep. So when you go to bed, when you wake up, or the midpoint of your sleep. Sleep efficiency or sleep quality, and duration, the amount. So you see duration, quality, timing, absence of sleep disorders. There's many things at play here. And this year, the group of Jody Mendel came up with the same stated acronym, but they added behaviors to apply to the pediatric population. So to look at many aspects of sleep health beyond just a number, which is sleep duration. That most studies look at sleep duration because it's easier to assess, but I think that it's more complex than just the amount of sleep, and many aspects of sleep matter. And in 2019, with one of my colleagues in Ottawa, because we had questions, people were telling me, JP, I would like to assess sleep in clinic, but then I don't have time for that. Can you come up with good question that have been validated, but I can use in 1 or 2 minutes max, and to have a good snapshot of what is good sleep or bad sleep in my patients? I said, yes, we can do that. So we published that paper 2 years ago. And with those 6 questions here, we assess 5 characteristics of sleep. So sleep duration is assessed by question 1, sleep quality by question 2, sleep timing, question 3, daytime alertness, question 4, and screen for a possible sleep disorder, the 2 key one, insomnia and obstructive sleep apnea, question 5 and 6. So the answers you can see here were adapted for adults, but you can use the same questions for teenagers or school-age children if you want. And the paper is open access, so you can find that in PubMed if you want. So beyond also trying to improve sleep in clinic, I think we need more public health strategies, so then it becomes easy for people to have a better night's sleep without the involvement of clinicians. And there's many things that can be done. So I published this paper 2 years ago as well, talking about things like to delay school start times for adolescents. So because so many studies show that it's good for them, they sleep more and better outcomes. To eliminate daylight saving time. So it's coming for us very soon. And we know that the intent about 100 years ago when it started was to save energy and money, but now it goes against the original intent. So I think it's a matter of time. We see that in many countries. We have bills now to eliminate that. I think we will not see that in the future. to regulate extracurricular activities so that when teenagers, they don't have that very late, so then they come back at home and then they just can't sleep because they're very wired to play hockey or other sports. To block the blue light of screens coming from our devices, so instead of wearing sunglasses watching TV, so it should come from the screen itself. There's many apps, but there's many ways that it can be done from companies as well. To regulate sleep in childcare settings, talking about napping with large differences between childcare settings. To integrate sleep health, the ABC of sleep in the school setting as well. So we talk about food, we talk about exercise, but also talking about sleep will be a good thing as well, and stuff like that. So you can see that it's not just working on improving sleep of people, but it can come from policies that will impact everyone. The integration of pediatric sleep health into public health guidelines in Canada is very recent. It's only since 2016 that we have our own Canadian 24-hour guidelines, and sleep is part of it. And why it's part of physical activity guidelines in Canada and the US, they just have their sleep guidelines. They have physical activity guidelines different. So I think we felt it just makes sense to have that with physical activity, because if you add up, you see in that triangle, physical activity, sedentary time, and sleep is 24 hours. So any change in one of these three behaviors will impact the other one. So for example, if you tell people to move more and they wake up early to go exercise, the impact on health will not be as good as if they were giving up some TV or giving up some sitting time. So we need to think about the gives and takes. So what do we replace? So it's at the expense of what? So that's why I think looking at the 24-hour approach makes sense. And all of those three behaviors impact the other behaviors. So if you don't sleep enough, you tend to move less, you tend to sit more and watch more TV, and engage in your screens, and the other way around. So they're all interconnected. So it just makes sense to see that as a whole. And more countries are following up with us in Canada and have their 24 guidelines as well. Many tips that you have heard to have a healthier sleep. So for example, going to bed and wake up at the same time every day, even on weekends, to be consistent is very important. Have a routine is important as well, like brushing your teeth in the morning and evening. So I think have a relaxing bedtime routine is important. Avoid caffeine consumption starting in the late afternoon. Of course, we see large differences between people. Some people, like my mom, can drink a tea in the morning and she can sleep at night. And me, I could drink a coffee before bed and I will be fine. So we see differences between people, but sometimes we feel we're fine. But if I measure myself with a polysomnography in a sleep lab, even though I think I had a good night's sleep, the objective measure will tell me that my sleep quality is not good. I was not as efficient. Avoid drinking alcohol in the evening. So alcohol helps you to induce sleep. You fall asleep quicker, but it will be a sleep stealer for the second part of your night. So it will be a reduction in your sleep quality. So it's not good. Avoid smoking cigarettes. Cigarettes, it's a stimulant. So it's not good for most things for your health, but also for your sleep. Expose yourself to bright light in the morning to reset your clock, because we have a 24-hour cycle. So I think it's important to be exposed to the sun, to go outside more in nature, to be exposed to the sun. More difficult wintertime when it's more dark, but I think it's important to go outside as much as possible. Make sure your bedroom is conducive to sleep, should be dark, quiet, comfortable, and cooler than the rest of your house. So there's nothing, it's very bad to have a very warm bedroom. Sleep on a comfortable mattress and pillow, so invest in that. We sleep 1/3 of our lives, so I think it's good to have a good bedroom environment. Move every day, so the best is moving outside, better than inside, and with fresh air, connection with nature, vitamin D, all of those things. I think the benefits of outdoor physical activity have been demonstrated to be better than indoor if you can. And this is my first advice for people: if they don't sleep well, do you move every day? And we know that we have an epidemic of physical inactivity in Canada that is linked to the epidemic of sleep deprivation in Canada. So I think we use our brain a lot, so we are overstimulated. So the mental activity is very high, but the physical activity is low. So we need to balance that. So with enough physical activity to counterbalance the excess of mental activity that we have and mental stress. Develop a relaxing routine before bed. So routine is very key for young kids, but for adults as well. So to wind down, having a bath, music, reading a book, so a hard copy book before bed, especially in the 1 hour before bed, is very key. Don't go to bed feeling hungry, but don't eat a big steak with French fries before bed. So a snack before bed is a good thing. You don't want to hear your belly when you go to bed. Don't have pets in your bedroom. I've had many questions about that. Yes, but my cat is very quiet or my dog is very quiet. So it's always better out of the bedroom if you can. But I agree that some pets might be better than others, but it can disrupt your sleep quality, of course. And the last one is a key one. Try to keep all the screens outside of your bedroom and keep the bedroom environment for sleep only. And that's what we see with insomnia. So if you can't fall asleep, so don't stay in your bedroom. So leave your bedroom, go to a different room, read a hard copy book, because at some point, if you associate your bedroom with a place where you just can't fall asleep, it makes a connection in your brain, and then you repeat the same pattern. So break that pattern, leave the room, do something else, don't engage in screens, and come back later when you feel tired. I will just finish by highlighting some research we do at CHEO, and then we'll have some time for questions. I think I have 4 or 5 slides left, so plenty of time for questions. So this study, the Smart 2D study, we started that a couple of years ago with a small grant we got from the CHEORI, and then applied for a larger CHEOR grant. We got that. So we just finished collecting data this year, got delayed with COVID, of course, we had to stop, and I have a Ph.D. student that is supposed to finish next year, so got delayed as well, and she's using the Smart 2D for her papers, Caroline Dutil. So it's called the Sleep Manipulation in Adolescents at Risk of Type 2 Diabetes Study. So I will not present all of the outcomes because it's a big study. So we'll look at mental health, physical health, and so on and so forth. But mainly, it's a randomized crossover trial in high-risk teenagers with severe obesity, with impaired glucose tolerance. And what we do, we change we increase their sleep by 1.5 hours, not by giving them pills. So we just play with their bedtime. So the prescription is that we want them, so first they have one first week habitual sleep, so we know how much they're sleeping. So we monitor that with a wrist actigraph, so it's an objective measure of their sleep, so not with questionnaires. And then we randomize them. So either they increase their sleep by 1.5 hours per night for 1 week, or they decrease by 1.5 hours per night for 1 week. Washout week, and then they do the opposite. So those who started with increase in sleep, they do decrease, and those who started with decrease do increase. So we play with bedtime. Why bedtime? Because in a typical week, kids, they go to school, so we didn't want to play with wake up time to be to fit with what happens in real life, but play with bedtime. So the prescription was for them to go to bed either earlier or later. And we look at what happens to their sleep. First, are we able to increase sleep duration in high-risk adolescent? Was first to see if it works. And then if it works, can we impact outcomes by doing so? So what we see, so if the prescription is to increase by 1.5 hours, we've been able to increase by 54 minutes, by about 1 hour. So not an hour and a half, but 1 hour, which is pretty good. So the prescription is for them to go to bed an hour and a half earlier, and then with an objective measure of sleep, we see that they sleep 1 hour more. And then with a decrease by 90 minutes, they decrease by 80 minutes. So it's easier to decrease than to increase, but we've been pretty good at increasing sleep duration. And what we found, you can see HOMO-RI, because we collected blood samples, that in the increased sleep, an improvement in HOMO-RI, but no differences in the decreased sleep versus habitual sleep. So it could be due that because they're already high-risk adolescents, so by decreasing their sleep by 1.5 hours, they didn't add more impact on their metabolism, but by increasing their sleep, good impact on MRI, and also good results by increasing sleep on the Matsuda index, which is an indicator of insulin sensitivity, which is pretty good finding. So first, we found, yes, it's possible to increase sleep duration in high-risk teenagers, and by doing so, we impact outcomes. And we look at depression symptoms and mood and other things as well. So to conclude, if you're interested in sleep, so the two key organizations in Canada, credible sources, first, the Canadian Sleep Society. So if you want more info on anything related to sleep disorders or any other things, go there, or Sleep On It Canada as well, which is more like participation, but for sleep. So more advocacy around the public health aspect of sleep. What about sleep in COVID? What about shift working? What about melatonin in sleep? All of those myths, or to debunk things, go on the Sleep On It Canada website. And my last slide, so for take-home messages for you. So if you were sleeping or napping during my talk, just wake up. It was a good thing. But for take-home messages for you, first, progress has been made on the importance of a good night's sleep for all. I think we should see sleep as important as exercising and eating well in the package for good health. Sleep health is an important factor to consider in the prevention and treatment of chronic diseases. So not only for sleep disorders, but for keeping healthy people healthy, and thinking about that in the future will be important. We need more research in the public health aspects of sleep. The field is still dominated by the treatment of sleep disorders rather than their prevention in the first place, because it comes from the medical field. And I think we need more the public health aspects of sleep. And we need leadership and innovation in translating, disseminating, and mobilizing sleep health strategies. Thank you very much, and time for questions.
All right, thank you, JP. That was a great presentation. So many interesting things for us to be thinking about. I think you have something there for all of us, regardless of what our specific fields are. Many things to think about. We have lots of time for questions, so I'm going to open it up. If anyone has questions, you can either, probably raise your hand using the icon, and then I can follow up more easily. There's Jason. Okay, Jason, go ahead. Dr. Berman.
Thanks, Mona. JP, can you hear me?
Yes.
Great presentation, and a huge kudos to you and the HALO team for your leadership in developing these guidelines and the tremendous impact they've made across Canada and beyond. My question for you is around the pandemic. You, in some of your comments towards the end of your talk, you discussed around sleep hygiene and the challenges if you're using your bedroom for other things other than for just sleeping. And in the context of COVID and people working from home and schooling from home, people's bedrooms have become their classrooms, their offices, et cetera. And I wonder, have you seen, I don't know if you've had a chance to look at this from a data perspective, but maybe you want to just provide sort of some thoughts around this, the impact that that's having on people's sleep and quality of sleep.
Yeah, thank you very much, Jason. Thank you for being here today. So Jason is my boss. Always nice to get the first question from your boss. Yeah, I think during COVID, many things have changed. As I mentioned, I think we see more screen time. I think screen time has been important for all of us, for kids during COVID as well, working from home and schooling at home as well. And then it was already pretty high, and it's even higher now. So, and we use different rooms, as you said, our bedroom for that as well. So in a perfect world, I think it would be better to use not the bedroom for school or work if we can. Of course, we deal with different families coming from lower socioeconomic backgrounds. So for some people, it's just not possible. They may have, that's their main or only place in the room to work, to study. So I think we do the best that we can. So it doesn't mean that because we use a bedroom for that by default, for sure, our sleep will be impacted. No, I think it's a balance of behaviors altogether. I think we need to keep in mind this whole balance. No one is perfect, even though I'm Dr. Sleep. My sleep is not perfect. It changes over time. And I think that's something to keep in mind. We do the best that we can. I think we need to move as much as possible. That's been shown to be we're way more efficient in our sleep. So even though we sleep less, for example, if the time we're in bed that we're more efficient, it's very important. So, and the key driver to that is to be active every day. That has been shown by many studies. So I think at least 80% of the time you're in bed, you should be sleeping. So if If you wake up 3-4 times at night to go pee and stuff like that, you're not efficient. I think there's other things you should change. Check more boxes in your sleep hygiene tips, or if you suspect sleep problems, consult people to see if there are underlying problems. But I think with regard to school and different rooms, I think it's the reality of many people. We do the best that we can, and I think we hope it will at some point come back to normal. But I think in terms of behaviors, I think sleep has been one of the good ones. If I compare to physical activity, diet, alcohol intake, I think many people are sleeping better now compared to before the pandemic, because we have more flexibility in our lives. So, which is a good thing. But for some people with more anxiety, more stress, they sleep less. So I think that's with those people we need to work a bit more.
Thanks, JP. And I'm looking at Dr. Jabbour, and whether, based on your talk, you've inspired her to include a hour-long siesta during the day for the department might be in everyone's best interest.
I would definitely do that if that's possible. Personally, I'm a big fan in naps, and I think it's a great idea. And actually, I was going to ask you that question, JP, about, you talk about number of hours per night. And you mentioned briefly about naps, but my question is, what is the evidence of, total hours per night versus cumulative hours of sleep during the day, including the naps, and also thinking about, respecting your triangle of physical activity, sleep, and sedentary activity. How much can you manipulate that triangle and still do well, whether it's children, adults, whatever.
Yeah. So I think short answer, most of your sleep should come from at night if you work during the day. But napping, let's say you sleep 6 hours per night and you nap 30 minutes, it's kind of 6 plus 30 minutes. You can add up those naps. So I think it's better to nap than not to nap. With regard to napping, Jason was saying 1 hour siesta. I think the long naps are not good, because a sleep cycle is 90 minutes. So you want to stay in the light sleep part of it. So the power naps that we call 20 to 30 minutes max, not 1 hour, because you will wake up feeling more tired. So short naps, so 20 minutes. And the best part of the day to have it, if you can time it, is between 2 and 3 p.m. where we have a dip in the circadian rhythm. Sometimes after lunch, we feel a bit tired. So the 2 p.m. part, but 20 to 30 minutes max for the nap.
So instead of going to the coffee shop for something sweet to eat, have a little 10-minute power nap if you can.
Yeah, and some people have their coffee and then they nap at the same time, because it takes 30 minutes for the coffee to kick in, and then they wake up even more awake. So yeah.
Giving away my secrets. Okay, there's a question in the chat from Dr. Odsent. I'll just read it, Toby. Any evidence about interventions that are effective in regard to behavior change relating to screen time, how to change those behaviors? She mentions that many ask the questions and provide counseling to patients and families, but the uptake is limited. Are there innovative public health legislation in other countries that we should be looking at or could be looking at?
Yeah, screen time, I think, is a very key one. I think it's something we've seen changes in recent decade, the last 20 years. I think it's a tough one as well, because we all rely on that. Social media for teenagers is so addictive. They're on Instagram and TikTok and everything that I can't even follow. It's very difficult. Yeah, I think what's best, some use motivational interviewing, cognitive behavioral therapy. There's many things, but I think it's really to work with the parents and the kids at the same time. So both need to be on board. And I think a key thing for me is that parents should be good role models for their kids. So it's not telling them what to do, but parents should also unplug at the end of the day as well. So I think it should be family time. And if we can all watch a movie together, but and have rules in the household, which is very important. So for parents as well. So I think we don't want our kids to be connected, but we are on our phones all the time as well. So I think it doesn't send a good message. So I think parents should unplug as much, if not more, than their kids if you want them to follow. But I think it's very complex. So it's not an easy thing to do. And I think to involve the whole family will be a key to success for me.
Yeah, great. Couple more questions in the chat. So from for shift workers, are there any recommendations that you would make in terms of trying to get that sleep if you're a shift worker?
I think your bedroom, as much as possible, should be dark. So invest in blinds that can really stop the sun during the day, because if it's very bright, it will be very difficult to sleep. The key thing with shift working, so what studies are showing is that if you, let's say you work from midnight to 8 a.m., if you always keep the same schedule, it's not going to be bad for your hormones metabolism. But what people tend to do, they work from midnight to 8 on weekdays. On the weekend, they switch, they come back to be with their partner and their kids. So then every week they switch their rhythm by 12 hours more or less. So that's a big stressor for our system. So I think to keep the same schedule, so even on weekends when you don't work, if you can be awake at night, will be the best. But most people don't do that. So I think to nap more would be a good thing, because sometimes you cannot get your 6-7 hours during the day, so you may sleep a bit more, and then you wake up, you move, and then you nap a bit later. So to split your sleep, as opposed to one big bout, you can have 3 bouts, for example. We're all different as well, but by default, it's going to be more difficult to sleep during the day than at night, because it's not as dark, not as quiet, and many other factors as well. But to rely on sleeping pills would not be a good thing just to sleep, for sure.
Just a quick follow-up on that, and there are 2 more questions in the chat, but is there any evidence for a physiologic progression in sleep? Like, you work a day, then an evening, then a night, as opposed to a day, a night, back to a day, and like flipping and flopping over the course of several days? Yeah,
so the more you stress your system, the worse it's going to be for all of your hormones and systems. So I think, the less changes in your life, in your 24-hour cycle, the best it's going to be. So we need to maintain the same, that we have a timing for our meals as well. That's why it's good to have the breakfast at a certain time, then a lunch, then a dinner and snacks. So the more we even respect the food timing, it impacts our sleep as well. So everything in our lives with those routines help us sleep better. So the bedtime routine is not just to wind down because we don't think about other things, but we make connections in our brain that the body is getting prepared to go to bed, and makes things easier. So all of those routine and cues are very helpful. And so the more we don't change things, the better. And we see that when you travel, you go to other countries with jet lag and so on. It's just more difficult to adapt. And you used to go to the gym, and then you don't go. You're a different country. So the more you just change your day-to-day life, it's going to impact your sleep pattern. And with aging, it makes a difference. So of course we don't sleep like babies anymore. So it's just the age effect. With the same workouts, with the same things, our sleep becomes just lighter. I'm 43 now, and I don't have the same sleep as when I was 25, and I still exercise every day. I eat well and stuff like that. But yeah, it's age.
Yeah, got to keep trying harder.
Yeah.
So a couple more questions. We'll try and get to both of them. One is, what has a higher impact on metabolic dysregulation? Are REM sleep or deep sleep?
REM sleep or deep sleep?
Yeah.
I think what happens when you don't, let's say you just sleep 4 hours per night, the body will preserve the non-REM sleep, which is the deep sleep. So the body wants to preserve that because the brains need to recover and rest. So I think the body will by default try to preserve as much as possible the deep sleep first. And then you're going to lose the REM sleep. And if you drink a lot of wine and beer, you're going to lose on your REM sleep, which is rapid eye movement sleep, which is good for your emotions, memory, and stuff like that. That's why we see people that drink a lot have more depressive symptoms, because it impacts their mood more, because it's the REM sleep that goes down.
Great. Thank you. Okay, and the last question, going back to the issue of napping, is there any risk, especially for teenagers, for taking long naps? Does that have a negative impact? Is it that it has a negative impact on their sleep at night, or just that they feel more tired when they wake up after a long nap, or both, I guess?
I think if they sleep deprived, they need more sleep. The best is to sleep more at night. but if they can't and they nap, I think it's a good thing for them. What can happen with younger kids, not teenagers, but I have a toddler at 3 years and a half, almost 4, and if she naps, she doesn't nap anymore. But younger kids, if they nap during the day and then they don't want to go to bed at night, so you don't want to delay bedtime because there was too much napping during the day. So preserve nighttime sleep first. Better not to nap, but as long as you can preserve nighttime sleep. But if you need a nap, I think it's better to nap than not to nap, that's for sure. So catch up sleep, even though some studies show that it's not as good as sleeping well every night, but catch up sleep is way better than not catching up on the sleep if you need it. So do it.
Okay, great. And we're just right on time. So I want to thank you again for a really great presentation and your discussion of the questions. It's very important for all of us to be thinking about, and we look forward to your further work in this area. Thank you again.
Merci beaucoup.
Okay. Bye, everyone.
Merci.
Rien.